Time now for this week's Health Matters. I've got PA Lynn Szabo on the phone this week. What's this? It says this episode, this segment is entitled Fair Warning?
Yeah, fair warning. This is about what is now called the variant of concern Delta, which was the variant of concern that previously known as India.
Okay.
So the one that killed a lot of people, so much death in India. And so these data are specifically from the UK, and the recording that I got them from was recorded on Friday, so it's really, really new data, hot off the press. And it's kind of amazing how much it's blown up since then. I don't know why it's not really being talked about, considering I think it's going to affect, California's opening. I think it should affect it.
Mm-hmm.
So let's talk a little bit mostly about what's happening in the UK and what is kind of expected to happen here in the next couple weeks.
Okay.
This variant of concern is about 60% more contagious or transmissible than the native wild strain COVID. So 60% more contagious. And it's not really, I didn't really write it down here, but the viral load, so the amount of virus that's in a sick person's body is much higher, and it's higher for longer. So what they can hypothesize out of that is that it causes more serious disease. Okay. So last Friday, they had 8,125 positives within 24 hours in the UK that were attributed to variant of concern Delta. So that was 51% of all the positives that they had. I'm sorry, 58.1% of all the positives they had. So it's the variant that's circulating the most in the UK.
Okay, so we're talking about, if we're running the numbers, about 15,000 new cases in 24 hours, and more than 8,000 of those new cases then were this Delta variant. Okay, wow.
Yeah. And then this is what's terrifying. The number of cases are doubling in the UK every 4.5 to 11.5 days.
Mm-hmm.
So the numbers are going up really high. People are staying sick longer, and people are sicker.
Wow. Okay.
So because it's more successful in transmission between people, it's displaced all the other variants. So it's not going to be very long before it's 100%.
Wow. Okay. Yeah.
This is kind of cool. But right now there's a decrease in hospitalizations, and so people should be curious about this. And there's two reasons that they're hypothesizing. One is time delay. So there's a time delay from the time somebody who has COVID finds out they're positive,
mm-hmm.
and if they're going to end up getting sick enough to be hospitalized, there's usually a 7 to 10 day delay in that.
Okay.
And since most older people are immunized, they're not really getting sick and getting hospitalized.
Wow. Just like it's supposed to be.
Right. So most of the people who are getting it in the UK are between 30 and 50 years old and are unvaccinated or partially vaccinated.
Wow. Okay.
So it's gunning for a whole different group of people right now. And it's unfortunate that they've been people that, thought that they were probably, if they got sick, it wouldn't really be a big deal.
Mm-hmm.
So
that's what happens with these things. They change.
They change. Science changes.
Quite literally, they mutate, and you could be looking at an entirely different form of disease. It's just, wow. So
right.
I see this next bullet point. Only 5% of people diagnosed, you've written, with Delta are immunized. So that's staying in line with the sort of the percentages, the efficacy of the various vaccines, right? We'd expect about 5% of the people to actually get the disease. True?
Right. So people are immunized are doing better, and remember the immunizations they have over there are mostly AstraZeneca and Pfizer.
Oh, okay.
So, there's not too much of a difference between each of those, different vaccines, but there is a difference between whether somebody's partially vaccinated or completely vaccinated.
Right.
And you can get completely vaccinated with Pfizer faster than you can with AstraZeneca, which is kind of irrelevant here because
Yeah, we
we
don't
don't
have
have.
it. Yeah.
But the people who are fully immunized who are getting Delta, they have less. There's less numbers of those people, less symptoms, and less severe illness. So they're not really showing up in the ER
Wow. Okay.
or in the hospital.
And again,
Okay.
this is something that was always the plan with the vaccinations, and it's not going to keep everybody from getting sick, but those who do get sick
Right.
will experience it less severely.
Right. So currently in the United States, when I wrote this, which was last Saturday morning, I think, there were 6% of the variants in the United States were Delta
Mm-hmm.
or variant of concern Delta. Today it's 10.
Wow.
It's
That's
so Saturday, Sunday, Monday, and we're recording Tuesday evening.
without getting into the statistics of it and how that changes it. We're
Yeah.
looking at it doubling in about that same time frame that you outlined earlier.
Right.
Yeah.
Right. So it's right on pace to be probably the dominant variant in the United States. My guess is in a matter of weeks.
Right. Right. Wow.
So what's happening today in California?
We opened.
We opened. I don't know why, and most of the science and most of the medical journals and stuff I'm reading are going, what?
Mm-hmm.
Why are we doing this? So in the UK, they had an opening date of the 21st of June, and they pushed it off for 3 weeks
Wow.
because of this. So in the United States, we're kind of ignoring that.
Well, and in California too, I think we're kind of ignoring that because our governor is facing a recall campaign.
Right.
Yeah.
Right.
So again, politics getting in the way of data.
Right. So that's what I wrote. So I expect the openings in California and the United States to be pushed back or open areas to be closed again if data means anything anymore.
Right. And
So
who knows?
I think we're looking at a political decision, and unfortunately the people who are being sacrificed for that political decision seem to be people who are aged 30 to 50 who are either partially immunized or not immunized.
Mm-hmm, mm-hmm. So taking this, like today, and we record this on Tuesday. It will air on Wednesday.
Right.
Today on community service on my show, for the first time in recent memory, certainly I can't pick out the last time this happened, there were no new cases reported overnight to the public health officer. That's probably already changed by now because they will
Right.
already have updated it. But that was for Monday night into Tuesday.
Right.
So what would be, here we are, first day, California opening. I went to a restaurant today, and the server was still wearing a mask, and we had our mask. My mother and I had our mask with us too, but and some people did, but most people didn't. And so I'm thinking, all right, what do we do now that those of us who are concerned about all of this, and in light of this new variant, of the Delta variant, what do we do moving forward? We don't have the backing of the government. We don't have the public health. We keep wearing our masks. We keep doing the social distance.
Right.
What would you recommend as far as just behaviors for individuals facing this today's health matters?
Well, the first thing is if you're not immunized, get immunized as soon as possible. And I believe there's a Thursday morning walk-in clinic at Elk Valley for United Indian Health, and they will immunize anybody who's there. And they have Pfizer, and I would try and go for Pfizer if I had zero immunization experience because there's only a 21-day. And so, you can go from 0 to fully immunized in 5 weeks.
Gotcha.
And that's the quickest you can do it. If you are partially immunized because you got Moderna and you were afraid you'd get sick, get the second shot and buck up and take a nap and get over it. I mean, it's really not that big a deal. And if you're being told by a local pharmacist, because there are a couple that are saying that if you have a too much of a delay in getting the second shot, then you can't get it. That's not really true. And you could walk into the Elk Valley site for United Indian Health and get Moderna too. So if you're not immunized, get immunized. If you're partially immunized, get that second shot. Now is the time specifically to reconsider if you've made a poorly informed decision in the past. But if you're secure in the idea that you don't need immunizations, then look at the pictures from India and reconsider.
Yeah.
Because it was pretty horrific. I think it's possible, in the influenza epidemic of 1918, the second wave. I think this is there was like a little tiny, or not a little tiny, a lot of people died, but a smaller, and then a huge monstrous. I
Yeah.
think we're looking at huge monstrous. So
Where are we in the progression of the huge? Is it just beginning? Do you
I
feel?
think it might be just beginning, and so I'm hoping I'm a chicken little here.
Even with the
It's
even with the vaccinations that we have in arms as we approach, and I forget what they're trying to push herd immunity in the United States, but there are pockets like where we live that will probably never
right,
reach that point.
right.
Um, I guess I'm just trying. Is it? I'm just trying to feel better about things. I guess, and it's hard to do with this.
Yeah,
But
number one, you're immunized. Number one, the people around you that you love are immunized. And number two, you carry your mask around.
right, and I
And
guess
use your mask. And I got a feeling with now that California's open, there's going to be like more mask hostility. And
right.
I'm going to wear mine anyway.
Yeah.
So,
Yeah, you can
um,
do that. Part of the new opening up is that nobody could stop you from wearing a mask. That is also very much a part of all of the new ordinancing and
right,
regulations and such. But
right.
yeah, it seems like just as everybody's really grateful, hey, we're back to normal. There are crowds playing at the playoff games and the NBA and all of that. But yeah, it is not again, again, not time to
Right.
take our foot off the pedal.
No, I don't think so. And I think this was purely a political decision.
Hmm.
And I think um, I think he made a calculated decision, and people's lives are going to be sacrificed, and that's awful. That
Wow.
really is awful. So I hope they figure it out pretty quickly. But
Well, it sounds like to me, and this seems to be like throughout all of this, where I've come back again and again and again, is that really we are all on our own here. And
yeah,
and if that is the case, then that makes health matters and what you bring to the community, even the informed, data-driven information that you bring, even more important and relevant. So if we're gonna have to all go it alone, let's all go it alone together. And thank you, Lynn Szabo, for keeping us on our toes.
yeah. Well, I hope I'm wrong.
Yeah.
So yeah. But this is the news for the week, and it was pretty horrifying, and it's fresh off the press.
Wow.
So.
Okay. Well, thank you. I know you'll
Um,
keep us up to date and updated on all of this. So, gosh, I hope for better news next week.
I know. I was thinking of talking about Alzheimer's, and maybe that would be better news, but
That's the
I don't.
twisted place we are.
I know this is really strange.
All right,
Okay,
Lynn
but
Szabo.
anyway,
Have a good
signing
week.
off.
Yeah.
Wear your
I'll stop talking. You go.
okay. Wear your mask. Get immunized. Just do it.
There you are. Thank you, Lynn. We'll talk to you next week.
Okay. Thanks. Bye.